Counselors Association webinar entitled Telehealth for Counselors, Zooming into a New Era. My name is Laura Giraldo, and I am the Executive Administrator of the Florida Mental Health Counselors Association, and I will be your webinar moderator today. So now I would like to go ahead and collect some information about you, our audience, for our presenter by launching some polls. Let's go ahead and share. So it looks like 91% of you are licensed mental health professionals, 3% are registered interns, 4% are counseling students, and 1% are counselor educators. So it looks like 37% of you are interested in summarizing ethical considerations for telehealth. 21% of you are interested to list and describe several telehealth platforms. 35% are most interested in locating updated laws and rules that pertain to telehealth, and 8% would like to know how to bill insurance for telehealth. It looks like 48% are only seeing clients via telehealth, 7% in person only, 31% both in person and via telehealth, and 15% are currently not seeing clients. Thank you everyone for participating in our polls. And now that we have a sense of who's out there in the audience today, I am going to go ahead and introduce our presenter. Erin Norton is a licensed mental health counselor and licensed marriage and family therapist, serving as Executive Director of the National Board of Forensic Evaluators, adjunct instructor at the University of South Florida, Southern Regional Director for the American Mental Health Counselors Association, and the President of the Mental Health Counselors Association. Ladies and gentlemen, please welcome Erin Norton.
Hello, everybody. Welcome. Good to see you all again. Some of you have seen me do a little bit of a presenting on telehealth through the COVID-19 resources for counselors webinars that we did. So you will see a little bit of that same information today, but you're also going to see some other things that we have not covered in any previous presentation. So hopefully there'll be a little bit of something for everybody on this. First, just want to really quickly make sure that you guys know what FMCA is. FMCA is a chapter of the American Mental Health Counselors Association, which is the largest association that exclusively represents clinical mental health counselors in the United States. And the Mental Health Counselors Association of Palm Beach is a regional chapter of the Florida Mental Health Counselors Association. And there are going to be a few points today where I think I'll highlight why it is so important to be involved in our professional associations. And I hope that you will see that, especially through these very difficult and challenging times where there are a lot of updates that impact our profession for us to keep aware of. What we're going to be covering today is a good definition for telehealth. What is it even? Because believe it or not, a lot of people are unclear about the definition, even though they think they're clear on it. We're going to talk about legal and ethical considerations for conducting telehealth, and of course, clinical considerations as well. So we're going to give an overview of some of the telehealth platforms, and we're going to cover how you bill for telehealth, but we're also going to have some time for some questions and some answers, and we're also going to go over a few different scenarios. There are real scenarios that involve clients and questionable situations when you're trying to provide a telehealth appointment. All right. Now by the way, I'm hearing some audio, Laura. It looks like they're in with their phone, and there's some noise in the background. Maybe one of our panelists. So hopefully, maybe whoever is on the phone could mute it, perhaps, so it's a little bit clearer for people. All right. Now, I also want to give you a little bit of information because we've been collecting some data, both here in the state of Florida and nationally, on mental health counselors and what we've been seeing in terms of the shift to telehealth ever since the pandemic really hit the United States. The first time that we did a poll, it was on March 26th, and it was in the Tampa Bay area. It was 15 mental health counselors, most of whom were in private practice. And at that point, about 12% of counselors were providing in-person services only, and half of us were doing telehealth only. And as you can see over time, and as we continue to poll different groups, we've been getting some different numbers, but overall, we're kind of panning out to about maybe 30%. Looks like there's a typo on one of these, but roughly about 30% of counselors are providing some kind of in-person service right now. And then the remaining about 50% of counselors are doing telehealth only, but an additional 18% of counselors are doing a combination. So pretty close to 70% of counselors that are providing telehealth. And that's pretty big when you consider that 20% aren't seeing clients at all. So the vast majority of counselors are providing telehealth now, and this was not the case prior to the pandemic. Prior to the pandemic, it was a minority of counselors who were providing telehealth, which means that you guys really jumped in there and you've been champs. I mean, you've had to make transitions, significant transitions in your practice in very short periods of time, and somehow wing it and get through it and do it as ethically and legally as you possibly could so we can continue providing care to our clients through a difficult time. A couple other charts if you want to look at them later that just sort of illustrate some of the data that we've been collecting so far. And by the way, for those of you who are members of the American Mental Health Counselors Association, very shortly there's going to be a new edition of the Advocate magazine that will be published, and it is a COVID-19 special edition. So you'll see several articles about some of the adjustments and changes that we're making as counselors because of the pandemic. I encourage you to take a look at those articles and stay informed. So I'm going to throw out another polling question here. The term telehealth includes both webcam sessions and telephone sessions. True or false? Looks like almost 70% of you said that the answer is true. A minority of you, 31%, said that it is false. And that makes me very, very happy that we are covering this exact item because the answer is false. And this is one of the common myths about telehealth. Here in Florida, we actually have a statute about this. Statute 456.47(1)(a). Telehealth means the use of synchronous or asynchronous telecommunications technology by a telehealth provider to provide healthcare services, including but not limited to, et cetera, and then it specifically says the term does not include audio-only telephone calls, email messages, or facsimile transmissions, which means phone sessions are not legally defined as telehealth in the state statute. And actually, neither do insurance companies consider it to be telehealth as well. This may be surprising to you that phone sessions are not telehealth sessions, but we're going to go into that in a little bit more detail very shortly, and especially when we get to the insurance billing component today. Now, there is another term. It's called Technology Supported Counseling and Communications. That's a mouthful, TSCC. This is a term that you will find in AMCA's Standards for the Practice of Clinical Mental Health Counseling, which is a great resource to learn all about the accepted standards in our profession in different areas of specialization. There we define this broader term, TSCC, as referring to the provision of mental health care services from a distance to clients through the use of technology. It can include telehealth, like we just described, but also other uses of technology like text messages and emails, for example. Now we'll get to another polling question here. To practice telehealth, an LMHC in Florida must first register with the state's telehealth provider registration. True or false? Looks almost the same split as the last question. About 70% of you say the answer is false, and 30% of you say true. And in this case, I'm going to go with the folks who said false. We do have a telehealth registry here in Florida, but The only people who have to register are people who are not licensed in Florida. If you're licensed here in Florida, you do not have to register with that registry. The Florida statute says that telehealth providers must practice within their scope of practice. So obviously, if I'm a licensed mental health counselor in Florida, I can't use telehealth to prescribe medications because prescribing medications is not within the scope of my practice. That's a given. It's no different than if you were providing sessions in person with somebody in that sense. But it also applies to those people who are outside of the state. So if there were such thing as a state where a licensed counselor could prescribe medications, and by the way, there's not, but if there was, then even though they could do it in their state, when they're doing telehealth with someone in our state boundary, they cannot prescribe medication because it's not part of the scope of practice of a licensed counselor here in the state of Florida. Now, providers can conduct evaluations through telehealth as well as therapy appointments. The same documentation standards apply when you're doing telehealth as apply when you're doing in-person services. And if you are licensed outside of Florida, you can provide services to our citizens as long as you are A, registered with the state, and B, you provide services consistent with our laws and our rules. So if you are an LPC, a licensed professional counselor in Georgia, and you want to do telehealth with your clients who are just across the state line in Florida, then you are responsible for knowing all of our laws and rules and following them when you are providing those services, which is a pretty big responsibility because you have to know the laws and rules, not just in Florida, but or not just in Georgia, but also in Florida. You really have to be knowledgeable of both. And that brings us to another polling question. Counselors licensed out of state must get their Florida license prior to providing telehealth with clients in Florida. Oops, I think we kind of already answered that one, but maybe you didn't catch it also. So we'll see what you guys think. Counselors licensed out of state must get their Florida license prior to providing telehealth with clients in Florida. And looks like about 60% of you are saying that is false and 40% are saying it is true. And I'm going to go with the people who said false in this case, because you don't have to have a license in Florida to provide telehealth with people who are in our state. If again you're an LPC in Georgia, for example, then you can provide telehealth to citizens in the state of Florida even if you don't have a Florida LMHC, a license as a counselor here in Florida, as long as you are registered and you're following the laws and rules of our state. There is a fee for counselors licensed in other states to get registered for telehealth in Florida. So going back to my scenario, you're an LPC in Georgia, you want to get on the registry to provide telehealth here in Florida, do you have to pay a fee, yes or no? And you guys so far are pretty split on this question. I think the numbers are about stopping here, so let's launch our results. You're almost half and half, but a slight majority of you say that the answer is true, that there is a fee, and then slight minority saying false. Okay, let's do one more polling question. And the question is, LMHCs in Florida are not required to participate in telehealth training as long as they are competent to provide telehealth. True or false? Looks like 68% of you say that is true, that you are not required to do telehealth training as long as you're competent to provide telehealth in the state of Florida. Okay, well, let's see what the answers are to some of these questions. Florida Rule 64B4-6.0012A, a licensee must complete 30 hours of approved continuing education credit. Now, this is when you renew your license. These are your licensure renewal requirements. You have to complete at least 30 hours of approved continuing education credit, including 2 hours on the prevention of medical errors during the 2-year period ending on the last day of the biennial renewal period. In alternating biennial renewal periods, the licensee shall complete either 3 hours relating to professional ethics or 3 hours relating to the provision of teletherapy. Oh, I bet you most of you did not know about this. It looks like 68% of you did not know about this. You're in good company because I didn't even know about it until a few days ago. I don't know exactly when this rule was amended, but I think it was revised very recently. Maybe they haven't even put out an announcement because I haven't even seen an announcement from the 491 board on this. And neither have some other people I've talked to, but you can see it right there on their website that we are now required to do 3 hours of teletherapy training every other biennium. Now, we're still getting some information on this, but one of you wonderful attendees had emailed us earlier this week and said, hey, how about you get that training that you're doing on Friday to be coded as a teletherapy training so I can get those special new hours that I read about. And my thought was, what hours are they talking about? So I go to the board rules, and sure enough, here I find it. And then we start contacting people. So we contacted the 491 board and we contacted CE Broker because I went in and I couldn't even see a designation in CE Broker to code a training as teletherapy. And that got me thinking they must not have an infrastructure in place yet to track this, or maybe it's so new they haven't got it set up yet. Well, the message I got from the 491 board, my interpretation of that message was that this doesn't start until the next biennium. So right now, our licenses expire when? Let me look at my license on the wall. 3/31/21. That's when our licenses expire. That's the end of the current biennium. The next biennium, starting in April of 2021, that is when we will be able to start doing these 3 hours of teletherapy. And so you might do 3 hours of teletherapy in 2021, and then 2 years after that, you're going to have to do 3 hours of ethics, and then 2 years after that, you're going to have to do 3 hours of teletherapy, and so on and so forth, and they'll be alternating bienniums going forward. Now, it's a little bit confusing, might sound a little bit weird, but that's what it says on the 491 board website. So that's a new thing. We have to do teletherapy training now. And I'm assuming that came right out of this pandemic because I did not see that rule there prior to the pandemic. All right, now there's the big question about what kinds of platforms do we have to use? And everybody is all kinds of focused on what's HIPAA compliant and what's high-tech compliant. Well, HIPAA does require you to use certain types of platforms with certain security measures. And one of the things that makes a platform HIPAA compliant is that you have a signed business associate agreement, a BAA, with the company providing that platform. So let's say, for example, that you decide to get a Zoom account and you want to be HIPAA compliant. Maybe you even go to their website, Zoom for Healthcare, and you sign up for the very expensive HIPAA compliant service, and then you tell yourself, great, I'm now HIPAA compliant. You're really not yet. You may think you are, but you're not yet, because now you have to go and request a business associate agreement, a BAA, and get it signed, which is the document that clarifies what Zoom's obligations and responsibilities are in the event of a breach of healthcare data versus what your responsibilities are. That is actually a requirement under the law that a lot of people forget about. So they just sign up, pay money for a HIPAA compliant platform, and then they're still not HIPAA compliant because they don't have a BAA. Well, there is some good news here, but I'm gonna, one hand giveth and the other taketh away. The good news is because of the pandemic, the feds, specifically the Office for Civil Rights at the US Department of Health and Human Services, they recognized, healthcare providers, they're gonna need time to adjust, but they don't have time to adjust. They need to continue providing services to their patients. And if they need to do that without using a HIPAA platform for right now, if they're acting in good faith and they're taking reasonable precautions, we're going to sort of look the other way and not enforce this HIPAA requirement temporarily. So they announced that. And by the way, if you go to the handouts on your GoToWebinar control panel, you'll see that one of the handouts is a PDF of all of the slides that I'm showing you. And every time you see something like this, that is a hyperlink. And the cool thing about hyperlinks is you can click on them and they will take you to the source of that information so you can read it for yourself. So you'll see that those are embedded in the PDF. So at first, all these counselors were saying, great, I can Skype with my clients and I don't need to have a HIPAA compliant Skype account. I could use FaceTime, I could use whatever I want, and then I can talk to my clients and not have to worry about HIPAA enforcement. But I would encourage you to not be thinking that way. And I'm going to tell you why. The first thing is, the spirit of that rule, when you read it, it's not saying that it's not illegal to use a non-HIPAA platform. It's saying, even though it is the law, we're not going to enforce it temporarily if you're acting in good faith and you're kind of in a pinch. But if the reason that you're not transitioning to a HIPAA compliant platform is like, I don't have the money yet to invest in that, then I think it's important to know that there is a free HIPAA compliant resource available. It's called Doxy. Many of you know about it. Many of you use it already. It's doxy.me is the website. The second thing is, so if you have a free HIPAA compliant resource, then why would you use an illegal platform? And I think that's going to be one thing that we ought to take into consideration. The second thing is that the announcement about the feds not enforcing doesn't supersede state laws. Now in Florida, I'm not aware of a state law that says you have to use a HIPAA compliant platform. So I think you wouldn't have to worry about that here. But I also give this presentation or a variation of it to national counselors from all over the country. And in some other states, they do have laws that would still make it illegal. So keep that in mind if you're in another state and you're on today. Or if you're providing telehealth for people that are in other states, are you breaking that state's law when you're using a non-HIPAA compliant platform? You would need to know that. The third thing is, I believe we have an ethical obligation to safeguard client confidentiality and privacy. And if we have a free way to do that, then why would we use a non-HIPAA platform? The next reason why is that you can still get sued for not using a HIPAA platform. See, what's a malpractice lawsuit involve? A malpractice lawsuit involves three components that the plaintiff has to be able to show is sort of 51% or higher probable, which is a different burden of proof than we would see in, say, a criminal case, for example, because malpractice is civil. But those three things are this. Number one, this counselor has a professional obligation to this client. In other words, you are my client. The person who is suing me is my client and I have a responsibility to them. The second component of a malpractice lawsuit is that I have breached my duty. I have messed something up. By messing something up, that could mean I did something illegal. It could mean that I did something that wasn't clinically sound. It could mean I did something dangerous, something that did not fit good practice standards, maybe something not evidence-based per se. They could allege that I've deviated from the accepted norm in my profession. Well, the accepted norm in our profession is to follow the federal law, even if it's temporarily being waived. So if I don't follow it, if I don't use appropriately encrypted platforms or the business associate agreement, a client could still convince people that you really have kind of messed up your duty. There was no need for you to use a non-HIPAA platform, and yet you did anyway. And then the third thing is that because of that breach of duty, I have caused harm to the client. So let's say that I'm using a non-HIPAA platform and someone hacks into that platform and they record the entire session with my client. And then they take that recording and they post it on the internet for the world to see. And then my client maybe loses a job, loses a relationship over it, anything along those lines. Could they come back and sue me and say, Aaron had a responsibility to me. I was his client. He breached his duty by using an illegal platform. And because of that, harm has been caused to me. That's all they'd really have to show. And for this reason, malpractice insurance companies have put out announcements very quickly and said, we do not want you using non-HIPAA platforms because we don't think we'd be able to defend you very well in a lawsuit for malpractice if that were to happen. So my malpractice insurance carrier is HPSO, and I saw an email from them about it, but I heard CPH put out one. I still have the email that my insurance company sent out. So that's another thing to consider. But finally, when, my position as far as COVID-19 has been is that I kind of think it makes sense to think long term, because it would be nice if the virus just sort of died out soon, or if a vaccination were readily available and widely distributed to the public in the near future. But I don't have any reason to assume that either of those two things are true. And it could take quite a long time before we have vaccination, might be a year or so before we have one. We don't know yet. So I think we got to think a little bit more long term, not just what's the, I'm in a period of adjustment, but we're probably going to be doing this for a while. We already have been doing it for a while. So we probably need to think HIPAA compliant at this point. Plus, I don't know when that exception is going to expire. I'd have to go back and check, but I imagine it's a very short term exception. So I very much want to encourage you today to use a HIPAA compliant platform. I will say though, I have said this in the past, and I got a little bit of criticism, which is well received criticism, that it gives the impression that I'm telling people, if you don't have a HIPAA compliant platform, abandon your clients and leave them to their own devices during a difficult time. And that is a very good point. I do not suggest that you abandon your clients. I think you have an ethical obligation to continue working with your clients. If you're listening to this webinar today and you do not have a HIPAA compliant platform, and you have a client session scheduled at 4 p.m. as soon as you get done with this webinar, I'm not going to suggest that you cancel that because you don't have a HIPAA platform. What I am going to suggest is that you very quickly, as soon as you can, transition to a good HIPAA compliant platform. And I'm hoping some of the information we give you today will help out with that. Now, before we move on to the next item, I think this might be a good just pausing point to see if there are any questions so far that would be good for me to attend to. Oh, Laura, there you are.
Aaron, okay, yes, we do have just a few questions here. So the first question we have says, I am a licensed marriage and family therapist. A colleague has asked me to serve as their registered agent. As a resident, my attorney relates that I am a registered agent. True or false?
Okay, so we have an LMFT and they're being asked to be a client's registered agent. And did the question say whether this LMFT is licensed in the state of Florida?
It says, so the question reads, I am a licensed marriage and family therapist. A colleague has asked me to serve as their registered agent.
I don't know what that means.
Okay, so this question was asked by Richard Long. Richard, if you could please type in some clarification for us, that would be really helpful. Then we'll come back to it.
Yeah, let's come back to that one.
Okay, perfect.
I might not be well suited to answer that question.
Okay, so the next question we have, is there a listing of states where Florida licensed practitioners can provide teletherapy with clients residing in other states?
There is, and we're going to cover that in a future slide. So okay, we'll get back to it.
Perfect. All right. Do you know if we can provide telehealth to clients in another state, not Florida, if we are not licensed in the state?
Yes and no. And we'll cover that too. That's going to be in an upcoming slide also.
Okay, perfect. Okay, and now I think someone is referring to being able to provide teletherapy services in Florida. this person would like to know how we can get that change to protect clinicians licensed in the state of Florida. We shouldn't allow those out of Florida to work with Florida residents without a license.
So this is a good question. I should clarify, first of all, just because of the verbiage of the question, I want to make it clear that you still, a counselor from another state still has to be licensed to provide telehealth to people in Florida. It's just they don't have to have an LMHC in Florida. They could be an LPC in Georgia or an LCMHC in Utah. So they still have to be a licensed counselor, just not in our state. They don't have to have a license in Florida. That being said, it sounds like the spirit of the question is, Aaron, doesn't this provide like competition for us? If counselors in other states get to just work with all our clients, then what if we don't have enough clients for the counselors in this state? That is a very good point. Now, what might help out a little bit and be a little reassuring for you is to find out, in a future slide, we'll cover just how much you can work with people outside of your state, expanding your pool as well to compensate. But this is a matter of law. This is a law that was passed by the Florida legislature. So if we wanted to change that law and make it so that people licensed in other states could not provide telehealth to our clients unless they also had a license here, then this would require lobbying to get legislators to change the law. And since the law was passed not that long ago, I don't know that I'd feel particularly hopeful that the legislator would go around and completely reverse themselves when they just passed this law. I want to say it was not even a couple years ago, maybe, but maybe they'll change their mind. And I think we'd find it particularly hard to get them to do so during a pandemic, because they're probably thinking to themselves, we need all the help that we can get because people can't see people in person. Maybe we need more services available right now. So I wouldn't feel particularly hopeful that we'd be able to get legislation through to change this law, but maybe that could be a priority. And this is a good point to plug the FOMCA Government Relations Committee, because we do have a committee whose job is to target what are our legislative priorities, what do we want to lobby for. And any one of you who becomes a FOMCA member, you could say, you know what, I am interested in serving on that committee and having a voice and playing a role in what our legislative priorities are. And even if you're not on the committee, you could be a member who sends a request or a recommendation to the committee that this item be considered. But I will tell you, I think it'd be a tough uphill battle right now. And I would instead look at how can you compensate for it. Now, I don't know about you guys, and I respect everybody's position is very different, but I'm seeing like 35 clients a week right now, which is way more than I usually would see in a week. And the demand is extremely high. I have more clients than I know what to do with. And I think part of that's because of the pandemic, actually. I feel like there's adequate business available for people, but that may not be your experience in your area. So I'd love to hear about the experiences you're having. If you're having a hard time getting clients because you think a lot of people are seeing counselors from other states through telehealth, for example.
Okay,
All
thank
right,
you.
very long answer to a short question, sorry.
Thank you for that information. Next, we have, can you address whether you need to be licensed in Florida to do teletherapy with clients in Florida after the crisis is over?
Well, because the telehealth legislation that I just referred to was passed prior to the COVID-19 pandemic, again, I think it would take a reversal of the law in order for anything to change after the pandemic. So after the pandemic, that law is still there that says if you're a licensed counselor, if you're licensed in another state, any healthcare provider, not just a counselor, then all you have to do is really register with our state and follow our laws and rules, and you can provide telehealth with our citizens. That's not going to change after COVID-19 unless legislators pass a new law.
Okay. Let me see. I am reading the renewal requirement as altering a medical errors course with a course on ethics and boundaries, or a telehealth course biannually, not necessarily both. Am I reading it wrong?
Oh, I thought it said you have to do medical errors and you have to do ethics or teletherapy alternating bienniums. But I don't think it can replace the medical errors requirement the way that I read it.
Okay.
I think it's in addition to medical errors.
All right. Is a BAA needed with DoxyMe?
It is, absolutely. And I have Doxy. It's one of the platforms I use. I use more than one platform because I have backups in case a site's down or something. And I went and got them to sign a BAA. I got my Doxy account, but then I had to specifically get the BAA from them for me to be compliant.
Okay. Next question. As a qualified supervisor, some of the interns are asking if they will be allowed to do virtual counseling outside of the COVID-19 notification. I believe it is a no, but wanted to make sure and ask.
Yes, good question. The short answer is, as of right now, no. Once the emergency rule expires, well, this actually gets a little bit hairy. So we're going to put that question off for a moment because we're going to cover it in an upcoming slide anyway. And actually, I'm kind of getting the sense that a lot of the questions are things we're going to cover anyway. So I'm going to go back to the slides then and see if we can cover some more of these items and then see what questions are left over. Sound good?
Sounds great, Erin. Thank you.
So interns and telehealth, speaking of which. So as the question just now implied, the 491 board issued an emergency rule that allows interns to complete all their supervision hours through webcam. They can count their teletherapy hours towards their 1,500 hours of face-to-face psychotherapy, provided that 4 conditions are met. The first is they have a qualified supervisor. That's a no-brainer. They have to have one anyway, right? The second is they have to have a telehealth protocol and safety plan in place, which they really should work with their supervisor on. Third, the therapeutic relationship had to have started prior to 3/19/20, which meant no new clients can be seen through telehealth. And then finally, for private practice only, a licensed mental health professional had to be on the premises when providing clinical services. Okay, that one is all kinds of weird, but let me explain this a little bit. First, this emergency rule, I just want to say, is an example of something that I think I have reason to believe was directly tied to our advocacy at FOMCA, because we were getting lots of complaints from our members saying, hey, our registered interns, our practices are closed, we're not seeing people in person, and the interns can't use telehealth towards their 1,500 hours of therapy. Help! So we contacted the 491 board, which has been very responsive to us. They've done a great job. I mean, there were times when I sent them an email at 10 o'clock at night and got a response at like 10:15. It was amazing, the response that we were getting from the 491 board. They were really working hard. So they passed this emergency rule, but when they passed it, we did not like these 2 things. Now, this wasn't part of their emergency rule, D, it's a statute. We'll come back to that in a moment. This was a part of their emergency rule though. And we didn't like that because we wanted interns to be able to see new clients. Let's say that you were an intern, you work for a community mental health center, which community mental health centers primarily use interns as their workforce, let's face it. Who do CMHCs serve? They serve predominantly low-income clients and Medicaid clients, not always, but that's a big, their population is skewed in that direction. So if you are a low-income Floridian, where are you probably going to get your services? You might be going to a community mental health center, which is staffed primarily by interns. If you're a new client and you're distressed by COVID-19 and job loss and all kinds of things, and you contact a community mental health center, they would have to say, well, I'm sorry, we can't start you on any therapy because interns aren't allowed to see new clients through telehealth. And that was a major concern for us. It was also the concern of some legislators. So letters were written, like the one you see here, to try and get something to be done about this. And we also wrote a letter, and there was an amended version of the rule passed on April 3rd then by the 491 board, which removed that requirement. It said, okay, never mind about the part where the therapeutic relationship had to be initiated prior to March, whatever it was, 2020. So interns can see new clients through telehealth now, but what about those interns who are in private practice settings? This is where things get a bit ugly because unfortunately the 491 board has no power to do anything about this. They can't do anything about it because it's a matter of a state statute. The way it works is statutes, laws get passed. Those laws say, hey, we give power to the board to do certain things, but only certain things. One thing that a board cannot do is change a law. It can't undo a law. It doesn't have that power. The board has the power over rules. Rules are established by the board under statutory authority. An example of this is there's a statute that says mental health professionals have to have a treatment record. And then it says, and by the way, the licensure board gets to provide more information on what those records are supposed to look like. So there, the statute gave power to the board to do something, to create a rule. So then you go to the board of rules and you see, hey, your treatment record needs to include a treatment plan. It needs to include records of expenditures. It needs to include progress on a treatment plan, any diagnoses that are applicable. Well, the statute didn't say that, but the statute said the board has the power to pass a rule requiring more information about those records. In this case, there's literally a statute that says that if you're an intern, you are required to have a licensed mental health professional on the premises when providing clinical services. Now, when that law was written, no one was thinking about telehealth, I imagine, and certainly no one was thinking about a pandemic, but it is the law. So what that would mean is if I'm an intern in a private practice setting and my private practice, my group practice, for example, is no longer seeing clients in person and we're doing telehealth only, then if I'm at home doing a telehealth session, I better have a licensed mental health professional somewhere in my house or else I'm breaking a law. That's a very bizarre and odd scenario. And it puts these interns in private practice in a very difficult situation. Do I unethically abandon my clients during a troubling time? Or do I break a law that says I gotta have a licensed mental health professional on the premises? Now, I can't tell you what you have to, which choice that you should make. But I could tell you that what we did in our practice is we continued to work in our office. And even if you weren't seeing any clients in person and you were just doing telehealth in the office, you would know that another licensed person was somewhere in the building. You're going to be socially distancing, you're not anywhere near each other, but you're still providing telehealth and you're still doing it with a licensed person on the premises. And that's one way to sort of work around this, but that may not be the appropriate strategy for many people. So we wrote a letter to the Attorney General saying, maybe you guys could like do sort of like the feds did about HIPAA compliant platforms and say, hey, we're not going to enforce this statute temporarily during the pandemic. Well, that didn't work very well. We got an email back from them and it said, yeah, you should talk to the Department of Health, the Surgeon General, or your legislators. Little did they realize there had already been communication with the Department of Health, who sent us to the Attorney General's office. So we're kind of going back and forth. And as far as legislators go, since there was no emergency legislative session, we didn't look likely that there was going to be a law passed to amend that law about interns in private practice settings. So our next step is we sent a letter to the governor asking for maybe an executive order that relaxes enforcement of that law temporarily. And to this date, there hasn't been any action. So it is what it is right now. I know a lot of practices are starting to open up again. Most have not yet. So you'd have to decide as a private practice what you're going to do with this situation for now. And it's kind of, I see it as a clash between law and ethics. Now, if you're an SAP, a substance abuse professional, which some licensed counselors are, meaning you conduct DOT evaluations, Department of Transportation Substance Abuse evals, there is a federal law or federal code that says you have to provide them in person and you cannot see them through some kind of webcam or electronic means. But the good news is that they recently retracted that and They are now saying you can use the technology during this pandemic to do your evaluations, but you really need to make sure that you're doing it well and that you're still providing a very thorough evaluation, to sort of paraphrase. But you can read the details later if you're an SAP and you want to learn more about that by using the handy dandy hyperlink right here. So as far as getting started with telehealth goes, many of you aren't going to find this particularly helpful because you've already got a platform. But remember, what if you're one of the people who are currently panicking because I just got done making a big fuss about how I think you really ought to get a HIPAA compliant platform and you don't have one yet? Well, again, you can go to Doxy. Doxy is free, but there is a drawback. Early on in the pandemic, we were getting reports from members that there were times when the Doxy website was down or not functioning properly, probably because of a dramatic influx of new users. We haven't been getting those reports for a while, so I believe that was a temporary adjustment issue. But the second thing is that there is a Doxy Pro version, kind of a premium account. It costs $35 a month, and it gives you superior streaming, but it also gives you the ability to meet with groups of clients, I think up to 10 clients. So if you sprung for the $35 a month version, then I don't think you would see the same issues that we were seeing early on. So that's something to consider. Zoom for Healthcare is what I use. I actually use both Doxy and Zoom for Healthcare, but Zoom is my primary resource. I like Zoom for a lot of reasons. One is I love playing when I do telehealth. And what I mean by that is I like using the whiteboard, and me and my client can collaborate. We can draw things, we can write things down, we can make lists, we can share things. I like sharing my screen with them. You can do screen sharing with the Doxy Pro version, but not the Doxy free version. The Zoom software just has some extra features that kind of make telehealth a little bit less dull and boring for me and more interactive and enjoyable. Having said that, it's darn expensive to get a HIPAA compliant Zoom account. So if you go to the Zoom for Healthcare website, now the standard Zoom or Zoom Pro, those are not HIPAA compliant. Even the Zoom Pro that you're paying for is not HIPAA compliant. Only Zoom for Healthcare is HIPAA compliant. The minimum cost on their website for Zoom for Healthcare is $200 a month. That's expensive. If you're a solo practitioner, especially, that's a lot of money, especially we can get Doxy Pro for 35 bucks a month. But if you're in a small group practice and there are 5 of you or there are 10 of you, and all 10 of you go in, and then you can have up to 10 users under that Zoom for Healthcare license, all with their own unique passwords and credentials and their own unique meeting rooms and that sort of thing, then you divide $200 by 10, you get $20. Counselors aren't very good at math, but even that calculation I can do. So $20 a month per person in that scenario. Now here's a little secret. If you call Zoom and you tell them, I am a small practice, a therapist who $200 a month is, I don't need 10 licenses, I need 1, or I need 3, or I only need 5 licenses, and I can't afford $200 a month. That's not going to work. Is there any way that that could be brought down for a smaller practice like mine? Here's what they will do. At least they did it for me, and they've done it for everybody that I've had do this. They will offer you a $100 a month plan with up to 5 licenses. So if you have a small practice of 4 or 5 people, it might be affordable now for you guys to go in on it together. Even if you're by yourself, well, maybe you can afford $100 a month, but you couldn't have afforded $200 a month. So that's an option. GoToMeeting has a HIPAA compliant version, and if you click on the hyperlink, you can get to the HIPAA compliant version. I don't know how much it costs. Same with G Suite. Simple Practice and Therapy Notes are practice management systems. If you already use Simple Practice for your health records for your clients, then you might just add the telehealth service. Same thing with Therapy Notes. Therapy Notes is interesting. It's what I use. They just announced their beta telehealth platform, I want to say a few weeks ago. So if you're a Therapy Notes customer, you could get in on that beta platform and start doing telehealth sessions through your practice management system. So it's all integrated in one system. If you have a Therapy Site's website, they have an add-on telehealth feature that's very affordable, and VC is another one. I did hear about some tech glitches with VC. when everyone was flooding to telehealth, but maybe those have been resolved by now. You can't just get your platform, of course. You also have to provide your clients with instructions, and you have to create a telehealth consent form. And I recommend that you also read section B6 of the AMCA Code of Ethics, the brand spanking new one that just came out in 2020, and also section E of AMCA's standards for the practice of clinical mental health counseling to educate yourself on the ethical considerations of telehealth. And finally, I recommend completing a telehealth training program, a formal program with CE credits, because this is again another way to demonstrate that you did your duty by getting appropriate training in telehealth as you made the transition to telehealth. And, again, I'm kind of a little conservative about some things. So from a malpractice standpoint, that's a very good idea. Now, you could also seek certification. I'm sure there are many different certification programs out there, but the ones I know about, NBCC does have a credential now called Board Certified Telemental Health Provider. And it costs less money than the other NBCC certifications. Evergreen Certification Institute through PESI provides a credential called Certified Clinical Telemental Health Provider. And there's also the Telehealth Certification Institute, which is misspelled here, but and they do some partnering with AMCA. So if you're an AMCA member, you can get a discount, if I recall correctly, for their certification program. You could look into that. So these are 3 options, and you can click on those links later and learn more about them if you want. Now, I do want to show you a consent form. I want to show you telesession instructions, and I want to show you a neat little thing that I did for clients who are extra tech challenged to show them how can you join a Zoom session from an iPhone or a tablet. So let me veer away from the PowerPoint here for a moment to show you guys some of these resources. This is what my telemental health electronic consent form looks like. You know what? I should have put this in the handouts, but it kind of is there anyway. Because again, if you click on any of these links, you can access the PDF, so you can download it that way from my Box account. Feel free to steal it. I mean, heck, I stole it. I revised it, but I took things from authoritative groups that had already created sample consent forms and shared them with providers with permission, and then I modified it. So first, I provide an introduction to telehealth so clients know what it is, and then I talk about how do you access my telehealth sessions and what do you do if there's a tech problem. And then we talk about payment, and we make sure they know that not all insurance plans and EAP companies pay for telehealth, so they should check to make sure that it will be covered before they do telehealth. We talk about the importance of safe, private, and confidential environments. I tell them I'm not going to be recording your sessions, and you're agreeing not to record them without us mutually agreeing to it in advance. We talk about security protocols, some benefits and limitations with telehealth. What kind of technology do you need to do it? How do we deal with exchanges of information? What happens if you need to see someone in person in your local area? How do you find somebody? By the way, did you know that you can decide not to even do telehealth with me? That's kind of important for you to know. And then what are some risks to using technology? And an emergency protocol, what do we do in the case of an emergency? How long will I take to respond to you if you send me an email or something? Where do I store information? And then finally, they consent. And the way I have this set up is I use therapy notes. So it gets sent to them through their client portal and they electronically sign an agreement. There's a second way though, if you don't have an electronic health record system that you can use to get this out to clients. And I'm going to show you that in a few slides here. Second resource, telehealth sessions instructions. It's not enough to give them a consent form, but I really want to make sure that they know if I'm interested in telehealth, how do I do that? And I give them, here's how you get started. You have to sign a consent form. You have to download the Zoom software, and here's the link you use to reach me. that kind of thing. Again, you can download this. And then here's a nifty little thing. I did this because I was inspired by two of my clients. One was a sweet elderly woman who is not exactly tech savvy. And then the other one was a client with a neurocognitive disorder who has a hard time navigating through instructions. I did a screen by screen instructions on how do you access your session through the app on your phone, where it literally points to them, what do you click on? And it gives them steps to follow. Because I really wanted to spell it out for them. So it would be very easy for them to do. So I'd encourage you to think about doing something like this for your clients who have a tough time with technology. Yeah, there we are. So next. Okay, now some people are like, what do I do about forms? Because if you're not meeting with clients in person, how do you get them their paperwork? How do they sign things? Second, if you are meeting with clients in person, I still do not think you should use paper documents anymore, because that's just another way to potentially pass the virus around. Client comes into the lobby, they sit there and fill out paperwork, and they hand that paperwork over to you, and then you got to take it from them and touch it and go through it and stuff like that, or hand it off to a support staff member to do. That's just a lot of passing stuff around, and we're trying to get away from that sort of thing. And we're trying to be, we want to social distance. If we're going to be meeting with clients, we want greater than 6 feet distance at all times. So how do you pull that off? Well, there is a HIPAA compliant platform that I recommend that you use for your electronic records, and it is called JotForm. Now, JotForm, usually the HIPAA plan is about $35 a month, but they do have the Coronavirus Responder Program. Under this program, you can access unlimited HIPAA compliant electronic forms until August 1st. And who knows, maybe they'll push that date back. And if you still needed to use electronic paperwork after that point, then you could decide to pay for the HIPAA plan if you wanted to. I do all kinds of fun things with JotForm. I have a coping strategies checklist. I have a daily plan. I have a daily mood chart. I have a thought record. It's the mother of all thought records. It goes on and on. It's like 30 minutes of stuff. And then the weekly relationship check-in. But I also have my intake packet, which is a doozy, and it's all done electronically, so they can sign electronically, and there's never passing around of paperwork. I have release forms that are electronic that they can sign through the platform as well. Now, you can steal my forms, and if we have time, maybe towards the end of the webinar, I might show you some of these neat little things. In fact, you know what I'm going to do? I'm just going to show you one of them right now, because I think we could do a quick deviation. Let's just do the daily plan because it's really short, sweet, and simple. Hopefully you guys can see that. It says, hey, welcome client. This is a tool I created for people while they're social distancing to not lose their minds while they're stockpiled in their houses. They put their name in, they hit next, they put the date and hit next, and then ask them to create a plan for the day. Especially do this for my teenage clients. Plan to do something productive today. Plan to do something that's physical today. Plan to do something social today. Plan to do something entertaining, something meaningful, and finally, something relaxing. And then submit it. And then just like that, your counselor gets, I just got on my iPad a notification that one of my clients has submitted a daily plan, and then I'll get to take a look at it. So I use it for therapy homework also. All right, let's get back here to, let's go over some scenarios. During a telehealth session, you see someone walk by behind the client. What do? You could go to the questions box and maybe a few of you could chime in. What would you do? You're doing a telehealth session with a client and suddenly you just see someone walk by in the background. Anybody want to say what would they do? Type it into the questions box and send it off to us. Close the laptop or cover the computer. Okay, so maybe I'm assuming you're saying maybe tell the client to do that, or are you saying you're going to close it yourself, or I'm not really sure. Somebody said, I will on my end. Okay. Remind them of confidentiality and to close the door. Stop talking and ask them to secure their space. Ooh, I like. Gloria says, I would ask the client about the person. Mary says, I would do nothing. Jennifer says, ask them to go to a private room. Astrid says, ask the client to move to a private area. Felix says, inform the client that they are not alone. Melissa says, mention it to the client. Celia says, I would ask my client if he or she is aware of it. Jamie says, also discuss with them beforehand. Good point. Lizette says, is your partner part of the session today? Kimberly, ask whether there's someone in the room and remind them that privacy is important. Suzette says, mention the person to the client and ask if they are aware that they're there. And Chetta says, I see you're not alone. Is it okay to keep speaking? Ooh, I like that too. Sonia says, remind the client of confidentiality. Oh, Julietta adds, ask them in the chat, because there's a chat for most of these systems. So you can type in, hey, did you know someone's in the room? And then see how they react. Okay. So it goes on and on. Lots of you are chiming and you've got some great ideas here. There's not necessarily a right or wrong way to do this per se, but for me, what I do is I will say, hey, I've noticed that you're not alone. Are you wanting somebody to be included in your session today? That's what I do. But I liked some of your other ideas where maybe you use a different approach as well. But it definitely, in my opinion, should be addressed. We shouldn't just like, I'll just ignore that and pretend it didn't happen. Next one, you're in the middle of a telehealth session and your internet signal suddenly goes out. What do you do? Wondering what you guys might say about that. Let me go back to the questions box here. All right, so Susan says panic. All right. I might have missed somebody too. Lena said this happened to me at the end. I was perplexed. Oh, that was probably about the previous question. Joanna, make a plan for who will be calling back. Mary says call the client. Katie says switch to the phone if needed. Catherine says text them and tell them I handled it. Eleanor says try to phone the patient. All right, the answers go on, and I personally call them. I don't just say, oh, well, and go about my business, but I call them up. And this is also where ethics and legality clash sometimes. You'll see why when we get to insurance in a few minutes. But if it goes out halfway through the session, I'm going to call them up and see if they're cool with doing the rest of the session through your phone. And then sleep well at night knowing that I did my best to do both video and audio, but the technology gods attacked me halfway through my session, and what can I do about that? And then try to also figure out what's going on with my internet signal here, and how can I maybe prevent this from happening again? Next one, while talking with a client, you notice that it looks like there's a Ring camera mounted to the wall behind the client. What do you do? Jamie says, freak out. Catherine says, ask if they are recording. Sonia says, inquire with the client about what I see. Wendy says, address it. Celia says, not okay. I would definitely explore it. Francine says, ask about it. Linda says, talk to your client about your concerns. Joanna asks them if they're recording the session. Karen asks them if they're aware of the camera. You know, here's where my mind first goes to. It goes to, could someone else be watching their session? Could a nosy parent be in the other room like, I'm going to see if my teenager is saying anything about me? Or a spouse or a partner or a child, because they're oftentimes better at technology than the adults are. A child might be going into the app to watch their parents' session. So I go to the client and I certainly put on, I say, hey, I noticed that there is a camera in your background. Are we being watched or recorded? Do you know that? Are you comfortable with this? Do you want to meet in a different room? to ensure privacy. And I would see how the client responds to that and then make sure it's directly addressed, obviously, and that we have a plan for what to do. You start a webcam session with a client and suddenly you realize that a family member is sitting right next to the client looking at the screen. So this is literally, I go to my virtual waiting room, I admit my client, and suddenly what I see in front of me is not just my client, but a family member sitting right next to them. And I'm like, we do individual work. Why is this happening? So what do you guys think about that one? Matthew, I'm sorry to say that you are not getting recognized. Part of it is, I'll be honest with you, I might get like 30 or 40 responses to a question, and I just read the first several ones, but I have been skipping a lot of people because we just wouldn't have time to read everybody's answer out loud, unfortunately. I hope people understand that. Francine says, say hello to the other person. Gail says, ask if the client wants a family member included in the session. Suzette says, ask if they are having others join our session today. Susan says, at my consent, I include the client needs to be in a confidential area and they need to use the headphones. Iron groups, I tell them the same thing, that they need to be alone in the consent form. Sonia says, introduce me to your guest and what are their intentions? Alina says, remind them that this is an individual session. Donald says, do you recommend earphones for confidentiality? I do, actually. Joanna says, ask when it's a good time to have a private session. Anthony says, ask if they plan to include the person. Okay, I'm going to stop reading just for time's sake. I know other people have great ideas in the chat as well. What I personally do is I will say, hi, I noticed that you have somebody in the room with you. Were you wanting someone to join us today? If the client says, oh yeah, I was hoping that I could have a session with you and my girlfriend today, then I would say, okay, we would need to do a little informed consent to have somebody visit in the appointment today. So I would ask, would you be willing, so-and-so to leave the room for a few moments while I talk one-on-one, and then we can look into informed consent. And then have the other person in the room, and then I talk to the client and say, okay, can you tell me what's going on and why you're bringing someone else into the appointment? And are you agreeing to me doing a session with this other person? And I have them sign a release of information. I'd have them do electronically right then on their computer right there. And then if I'm in agreement, if I feel comfortable with it, they have a good rationale for why it is that they're having this family member and I'm okay and they're okay, and we've had an informed consent, then I'll still do it. But you would have to make that decision as a clinician. It's kind of the same as if they show up in your waiting room with a family member and you're like, hey, Bob, let's come on back. And then suddenly this other person starts walking back with them. It's kind of the same scenario. And I think you would do something very similar in both situations. All right, next one, you start an initial telehealth appointment and then you see that the client did not complete and sign your intake packet, which means they haven't even signed a consent to meet with you that day. What do you guys think? I'll read the first few comments. Felix says, stop the session. All right. Joanna says, reschedule. Astrid says, ask for them to do it before starting the session. Irene says, I would reschedule. Lindy says, I don't schedule until my intake packet's completed. Wise idea, Lindy. Catherine says, I try to prevent them, but stop it if it happens. Jennifer says, explain to them that they must complete it before leaving the session. Gail says, pause and have them complete the paperwork and then proceed. Cheryl says, client has to complete and sign intake forms prior to ever being scheduled. Okay, so I agree. I personally would not be comfortable with going forward without the consent being signed, because what if they never sign it? Clients don't follow through with things sometimes, and what if you do a session with someone and they never even sign a consent? They say, oh yeah, I'll sign that at the end, don't worry about it, I'll get it to you, and then they never do. Could that become a malpractice lawsuit down the road? Could that become all kinds of things? So what I do is I say, hey, I noticed you didn't sign the intake packet yet. Let's go ahead and sign it right now. Since I use JotForm, I can have them go into their computer right then and at least fill out the minimum part of the intake packet and agree to the consent to go forward. They can do the remaining part of the packet, all the biopsychosocial questions later, but the consent, the informed consent, that legal document has to be signed before I meet with them. So if they didn't and they're on the screen, I have them do it right then. And if for some reason they can't do it right then I reschedule. Just my opinion. I know there are a lot of other great ideas out there, but we got to move on. So let's do our next scenario. You're talking with a client, and then while updating you on the past week, she mentions that she's in a hotel in Georgia. Georgia, right across the state line. And what do? Oh, Kimberly asked the question, how do you feel about getting a verbal consent for telehealth? Any laws about that out there? I don't feel good about verbal consent because it's still a legal requirement that people sign a consent for treatment. Catherine, pretend you didn't hear that part about the hotel in Georgia. Celia, I don't see a problem with it. Joanna says, keep the session. Victoria, I ask clients to verify the location at the beginning of each session. Linda says, confirm that she lives in Florida and is visiting Georgia. Regina says, get the phone and address of where she is. Elaine says, look up the Georgia statutes. Diana says, ask if she's alone, no problem. Irina, inform the client that we would need to reschedule when the client comes back to Florida. Okay, the mere strong variety of answers we're getting suggests we need some clarification in this area, don't we? Fortunately, we can give you clarification. We're going to start with, what if my client crosses state lines? Now, counselors have to follow the laws that govern the counselor's license and the laws that govern the location the client is currently in. Once that client crosses that state line into Georgia, you are now beholden to the laws of the land of Georgia. And so, is it legal for you to practice across state lines? That is the question. Now, no Florida law prevents you from doing it. As far as I'm aware, nothing in the board rules or the Florida law technically says, thou shalt not provide a telehealth appointment to a client in Georgia. But if it's illegal in Georgia and a complaint gets filed, then you're breaking the law in Florida, because there is a law in Florida that says you can't break laws of others. If other states issue complaint against you, now you're in trouble with us also. So keep that in mind. It's an indirect process. Well, the Code of Ethics says you got to be familiar with both. You can't just be familiar with one or the other. And so it's got to be legal in both places. Florida has to say you can do that, and Georgia has to say that you can do that. Now, how do you know if you can do that in Georgia? I'm going to show you two resources. The first is this app. It's a free app that you can download. And I'm going to try and show you it right now using a series of sophisticated technological maneuvers. What's the name of it? Man, Reflector. I'm going to try and use Reflector to see if I can show you literally what this app looks like and how it functions. Any second now. There we go. You can now see my iPad, I do believe. So I'm going to pull up the wonderful world, oh, wrong thing, of mental health. No, that's not it. There it is, Telemental Laws. Here is the free Telemental Health Laws app. You're going to go to it. You are going to click on State Guides on the left-hand side. You're then going to select the good old state of Georgia. And then you're going to choose counselors, because that's what you are, unless you're an LMFT or LCSW, in which case you'll select one of those options. Let's go with counselors. And then we're going to click licensing requirements. And the question is, are there any licensing requirements specific to telemedicine or telehealth to be licensed in the state where the patient is located? Or literally, it's about where is the patient, not where is the counselor. Here's what it says. A license issued by the Georgia Board of Professional Counselors, Social Workers, and Marriage and Family Therapists generally is required to practice as a counselor in Georgia. Here is the code, and it basically says you got to be licensed here. So in other words, they have no provision in their law or their rules that says that if you're licensed in Florida, you can do telehealth in Georgia with someone who's literally in the boundaries of Georgia, unless you're also licensed here. And that may terrify you. But I got some good news for you. There's yet another thing that we got to look at. The other thing we got to look at is we're in a pandemic. And guess what? A lot of states have issued temporary relaxing of their laws and rules to allow you to practice telehealth across state lines. Here's your website to find out if Georgia has such a provision. Because we know normally, pre-COVID, you wouldn't be able to do it, but can you temporarily do it during the pandemic? That's what this second resource is about. So let's click on it, shall we? And then let's stop the reflector thing and get out of that. Hopefully you guys can see my web browser right now, and you can see this page that says COVID-19, and you can see where it says states waiving telehealth licensure requirements. So we're going to click learn more. And then we're going to scroll down to the magical land of Georgia, and we're going to see if they have an exception in place right now. All right, sweet, they do. And now I'm no attorney, that's my disclaimer, but it appears to me that they have a temporary, you can do it even if you're not licensed here rule. So good news is, if you have been doing telehealth with a client in Georgia lately and you freaked out when you saw that the telemental health law app says you can't do that, you probably can right now the way I'm reading what I see here on this resource. So good news for you. So just use those two resources to make sure you're following the laws in both places. Now we move on to the issue of insurance. We at FOMCA on March 23rd, we created an open letter to all of Florida's health insurers saying, you guys need to make sure that everybody has telehealth as a benefit temporarily during this pandemic. And shame upon you if you do not. But we did it much more diplomatically than that. So we did that. And sure enough, a lot of insurance plans that didn't allow telehealth are temporarily allowing clients to have telehealth benefits. OMCA did the same thing on a national level. And these are letters that you can use as well to advocate. How do you bill for it? Not very many people were interested in this, so I'm assuming most of you have figured out how to get paid, but I still want to make sure we cover it. When you submit a claim, change the location code from code 11, which denotes in-person, to code 02, which is telehealth. Use the same CBT codes as usual, but you have to add a modifier. That modifier will either be GT or it will be 95. Now, both of those modifiers mean I can see the client, i.e. visual contact through a webcam, for example, and I can hear the client. This means telephone sessions are not telehealth. As we mentioned earlier, as the Florida statutes say, so does the world of insurance, so does CMS. They do not consider telephone sessions to be telehealth. And almost no insurance companies will pay for phone sessions. If you do a phone session with a client, but then you submit a claim with location code 02 and one of these modifiers, you have just committed insurance fraud. And that is a big deal. It may look like a tiny little itty bitty deal to you, but it could become a big deal. I would not recommend engaging in insurance fraud. I have seen people lose their licenses for such things. So make sure that you're using video and audio. Now, I did tell you earlier, I just got done going over a scenario with you where you start the video session and then halfway through it disengages. The internet signal loses and then I switch to phone. You could say that technically I'm doing something wrong in that moment, but I think I acted in good faith in that moment and I was making a very ethical decision. And I imagine that I think that the licensure board would rather me be defending myself for a good ethical practice than having me defend myself for abandoning my clients. Just my personal opinion. I'm no attorney, but I would say do everything within your power to prevent these kinds of situations from happening. Now, some people are like, do I use 95 or do I use GT? I don't get it. They're the same thing, aren't they? The general rule is use 95 for commercial insurance and GT for Medicare. But use the GT only if the payer tells you to not use 95. What I've learned is United prefers GT and all the other insurance companies seem to prefer 95. So maybe that helps for you to know. Now let's say, well, this might happen to a lot of you, it certainly happened to me. The first 2 weeks that people were panicking about the pandemic and places were shutting down, I got a lot of cancellations and no-shows. I don't know if you did also. And at that point, I started to panic a tiny little bit, telling myself, what if clients stop doing therapy because they don't want to do telehealth? And I thought, you know what I got to do is join one of those outfits that all they do is telehealth. And that way I know every client who gets referred to me through those resources wants telehealth and telehealth only. So in my moment of panic, I applied for Talkspace and I applied for Teladoc. And I got eventually admitted for both. But I will tell you, these are low paying. And so I started doing some Teladoc sessions. I only do like 1 or 2 of them a week right now. They do not pay very much though. And I really didn't need to switch to them because I have way more clients I know what to do with. So maybe I won't be doing it for much longer. But if you are having a different experience, if you're having a shortage of clients and you want to expand your telehealth reach, then these are some folks to apply for. Now, Teladoc requires the client to physically be in the state boundaries of Florida. And every session, you have to confirm that at the beginning before it'll let you go forward. You have to attest that this client has told you they are in the boundaries of Florida. If they're outside the boundaries of Florida, end game, no session, done and over with, because Teladoc doesn't want to break the law and get in trouble. So that kind of illustrates my point from previous slides. But these are some you can click on later if you're wanting to expand your telehealth reach. Now, a few tips and pointers. Pay attention to the lighting in your room. So just as an example, I'm going to switch here so I can see my webcam real quick, because normally when I'm presenting the PowerPoint, I can't. Notice how behind me there's white light because there's a window. That white light probably messes with some people. They don't like seeing, they might see a halo effect based on their vision. It would have been better for me to have closed those blinds so there's not a stark contrast between the lighting behind me and my face. Now, most of you probably aren't bothered by it. A small number of you probably are. And then another faction of you are like, well, it didn't bother me until you said something, Aaron, and now it's driving me crazy. But it just illustrates. Also, look at how bright the light is in that corner right there for most of you. That messes with some clients. Ideally, you'd have more even lighting in your background. I know it sounds weird, but these are little things that we don't think about very much. Lighting, what is the client seeing? Is it comfortable on their eyes or not? Can be an issue for some clients. Now let me go back to the slide though. Oh, let me go to the previous one. Think about background noise. You probably can't because of my specialized mic, but I have a fish tank here with an active motor and filter. Sometimes if I had a cheaper mic, you'd be hearing a bunch of drizzling water in the background and you'd finally have a sudden need to urinate. So think about that. That could annoy clients whenever there's background noise. Some people even have computers that have loud fans and all the client hears is some motor running in the background. And so things to be aware of. You should verify the identity of your clients. Now, if you visually recognize your client, in my opinion, you're good to go. But if it's a new client, I ask them to give me their name and their date of birth. And I make sure that matches what I have in the system, of course, but before I go forward, I ask them to attest that they are that individual. That's also what outfits like Teladoc require as part of their protocol. Be mindful of nervous habits. One thing I do is when I started doing telehealth, I got a standing desk because I don't want to sit down all day and look at a computer screen. But now I notice I'm like this during sessions and I'm moving around sometimes. That could get old for a client also. Consider specialized glasses for computer screens. I'm not wearing it right now, but normally when I do telesessions, I do wear specialized glasses that have a filtering that makes staring at electronic screens easier on the eyes. And that has been helpful because my eyes are not quite as young as they used to be. And use some of the special features that telehealth can offer. I mentioned the whiteboard on Zoom. I found it very helpful because me and my clients are making lists and we're creating diagrams. We can do genograms together, all kinds of neat things with those special features. And then there's an article here that you can click on that gives you 20 low-cost ideas for interventions you can do with young children through telehealth to keep them engaged and focused. On Zoom, since I can very easily patch my iPad or iPhone into the screen, we even play little games sometimes together that are mental health related. Like there's a CBT game for kids that you can project. I don't work with young children, I only work with adolescents and adults. So what I do with them is a little different than what you might do with young children, but there are resources for you. Now remember, it's not appropriate for all clients. Some clients don't have internet access. I was surprised, some of mine do not. It's very few, but it happens. Some struggle to use technology because of neurocognitive impairments. Some don't trust telehealth. They think the government is listening in on everything. Some are uncomfortable with telehealth. Some do not have appropriate equipment. Some lack privacy in their home. Think about, you've probably seen reports about increased domestic violence during quarantine. There are systems where it is almost potentially dangerous for a client to be doing a telehealth session at home. So we have to be aware of these things. Some clients are not tech savvy, like we kind of said earlier. Some do not have telehealth insurance benefits. Most do now, because most insurance companies, in my experience, have now started permitting telehealth across the board. I do want to spend a moment telling you how you can stay updated, and then we'll get into our questions and answers. There's a FOMCA member forum, and if we have time, I'll even show you a few of my silly forums online, or my self-help materials that clients can use. They function like apps through JotForm if you set it up the right way. The member forum, if you're a FOMCA member, you can go to this and you can subscribe to it. And each 24 hours, you will get one email, a digest, that tells you, here's all the stuff that was posted in the past 24 hours. We have a whole thread on COVID-19 resources for counselors. We have a thread on telehealth. We have a thread on telehealth and insurance, where we're like, hey, which insurance company uses GT again? I can't remember. And those kinds of questions. So it's a good way to interact with your colleagues and quickly get free information and resources. The same if you're an OMCA member and you use the open forum. And I encourage you to join the associations and take advantage of these benefits. Regionally, like here in the Tampa Bay area, we even have a webcam colleague collaboration. You can go in and you can staff cases with your colleagues for free. So these are some neat things that the associations are providing, and it is so important to get in with the associations, because some of the things that have happened that are lobbying for you during the pandemic, they came to be because of the associations and what we're trying to do for you. So that's enough for my soapbox with that. And here's contact info for me. You will also see this in the PDF. Remember, go to your handouts. There is the ethics. The ethical guidelines are in the handouts, as well as the practice standards, or the standards of practice for clinical mental health counseling. Remember, I suggested you go through and you read all the information about ethical considerations for telehealth in the OMCA Code of Ethics. There's a whole section on it. Then go and read the professional standards document from OMCA on technology-supported counseling, and read all of the information there. And that will give you a sense about some of the other unique considerations for doing telehealth. So now let me be quiet for a bit here so that you guys can have your questions answered.
All right. So lots of questions, Aaron. All right, let's see. Do we have to sign a new BAA periodically?
To my knowledge, no. I don't. There's none of the BAAs I've seen have like an expiration date or anything, so I don't think you do.
Okay. Let's see. Can you please repost how to check what states authorize teletherapy?
Sure. Let me go back to that slide here for you guys. And what I'll also try to do, oh, I passed it. I'll also try to paste the link into the questions box. Here it is. First, I'll post the link for, why won't it let me copy this? Oh, well, I'll post the link for the app that tells you, normally what does the law say? And then I'll post the exceptions because of COVID-19.
Okay.
All right, done the app. And now we'll do the COVID-19 exceptions. And I will put that in. So if you go to the questions box, you should see that I've now sent it to both links. And then I would copy those links and paste them to people, or paste them somewhere.
Thank you, Aaron. All right, the next question I have here is, it says, I have worked with some colleagues on creating a platform for matching therapists and frontliners to provide free telehealth during this crisis. What do I need to know to make sure that this platform launch is appropriately ethical and legal?
All right. Now, I apologize, but I missed the first half of the question. I got distracted for a second. Sorry. Could you reread it to me?
Sure, absolutely. I have worked with some colleagues on creating a platform for matching therapists and frontliners to provide free telehealth during this crisis. What do I need to know to make sure that this platform launch is appropriately ethical and legal?
Oh, okay. Well, I don't know that I'm the best person to answer that question, because my initial thought is if all you're doing is creating a way for like practitioners to connect, like let's say if all you're doing is you have a website and you say, hey, responders, here are all the counselors who have agreed to be a part of this project and their contact info, then I think you don't really need to do anything, because clients aren't going to be contacting you as the platform or storing information anywhere with you or anything like that. They would just be, oh, I see that Aaron Norton is part of this program, so I'm going to contact Aaron Norton's office, and then it's Aaron Norton's responsibility to make sure that he's doing things legally and ethically and so forth. And you can put a disclaimer on your website that says something like, we provide a listing of counselors who attest that they do this only, and each provider is responsible for their own procedures and for abiding by laws and rules, et cetera. You could do something like that. But if you're getting more complicated where clients are going in and they're entering information into a system and you're storing data and things, then I would think that would complicate things more and might be a good attorney question rather than one for me.
Okay. Okay, I pay monthly for Google Suite and signed a BAA with them. Does that make their Google Meet a HIPAA compliant platform?
So this one gets very technical and very confusing, but technically, just because an organization signed a BAA doesn't mean that they're HIPAA compliant. They, on their end, have certain requirements that they have to meet, and they may or may not be meeting those requirements appropriately. You're not a tech expert, though, so you may not be familiar with like what kind of encryption standards and how to implement those and things. So what I would suggest that's important for you is that you can show you've done your due diligence. You researched it, they say they're HIPAA compliant, you signed a business associate agreement, to you it looks like it's HIPAA compliant, and you can back that up. And then, they're either doing a good job on their end or not of following the law. That's my opinion, is you just do your due diligence. So if you go to a website like Google, whatever it was, Google Suites, I think it is, and you see it says right there that it's HIPAA compliant, and you join and you tell them, I want the HIPAA compliant plan. And they say, all right, here's the HIPAA compliant plan. And you've got it in writing and you've got a BAA. I feel like you've done your due diligence. I'm no attorney, but I think so.
Okay. All right, next question. Are we required to videotape while we are conducting virtual sessions?
No.
Okay.
Short and easy. In fact, I would say the opposite. Don't ever videotape a session with a client unless you've got a good reason for doing it and both you and the client are in agreement and the client has signed a consent allowing for the video recording. And that consent includes why you're recording it, where it's going to be stored, how it's going to be used, those sorts of things.
Okay. All right. I am licensed as a LMHC in Florida. Can I conduct sessions with Florida clients while I am visiting family in another state?
Oh, that's a really good one. So let's say I'm licensed in Florida. I go visit my family members in the Ozark Mountains of southern Missouri, and while I'm there, I decide to do some telehealth sessions. Do I have to be licensed in Missouri? I think if you go back to the reasoning that you have to be knowledgeable of the laws in both states, even though you're licensed in Florida, you are physically in the boundaries of Missouri. You're in their state. So I would think if their state law says that you can't practice any counseling in the borders of our states unless you're licensed by us, then you're probably breaking the law. Now, I have a colleague who moved to another country, and she wanted to continue providing services to her Florida clients while she's living in another country through telehealth. And I looked at it and said, well, if in that country there's no license for counselors, counseling is an unlicensed profession that you're free to engage in without a license, which does seem to be the case in that country, then you're not breaking that country's law. And there's no law that I'm aware of in Florida that you're breaking. So I think you're good. But if you're in a state here in the US and that state says thou shalt not, and you do it anyway, you're probably breaking that state's law.
Okay. Are Florida licensed mental health providers allowed to provide telehealth services to people outside of the country, like military family members, etc.?
Oh, that's a really good one. I would again go back to what is the law of the land that the client is in? If the client is in Ireland, I happen to know that Ireland does not yet have a license for counselors. They have approved licensure, but they haven't enacted it yet. So if the client's in Ireland and I'm in the US, Ireland's laws say anybody can do counseling that wants to do counseling. And Florida's laws say, hey, just follow as long as if you're here in Florida and you're licensed here in Florida, you're good, then you're not breaking either place's laws. But if Ireland had a law that said anybody in our country, if somebody outside our country provides counseling to somebody in our country, then they are breaking a law, even though the likelihood is probably low that anyone would ever find out or go after you. It could, and that could be an issue. So you really have to be familiar with the law of that country.
Okay. Could you address phone counseling for elderly clients who are not computer literate? Only communication they are able to utilize, and some cannot leave their home.
So I would say you can do phone sessions with an elderly individual, provided that you're not breaking the law on how you do it. So what I mean by that is, let's say that they have insurance and their insurance company doesn't pay for phone sessions, and you're billing this as a telehealth appointment, which means you're seeing them as well as hearing them. Well, now you're engaging in insurance fraud. But if that's not the case, if they're private pay, for example, or their insurance company is one of the rare exceptions where they say, we're cool with you doing telephone sessions, then I would say you're probably fine. And the ethical and professional standards would be very similar as they are when you're doing telehealth. You need to identify or be able to verify the client's identity. You need to cover with them where you're going to be at in your house, making sure they know that they should have privacy in their home while they're doing a phone session. Are they thinking about things like, do they have a landline phone that they're using and someone could pick up a phone in another room and listen in on their session? That's part of just the process of informed consent.
Okay. Can an LMHC now see Medicare clients since Medicare changed rules for
No,
COVID-19?
no. That one was easy.
I know.
Licensed counselors cannot bill Medicare. The COVID-19 stimulus or relief legislation that's currently in the Senate, we are trying to get them to add licensed counselors being able to bill Medicare to that plan, but it hasn't happened yet. I highly encourage you to go to omca.org and click on advocacy and then Medicare, and you'll see on the right-hand side of the screen, it says, click on this link, find out who your senator is, copy this template, paste it into an email, and send it off to them to encourage them to include this in the stimulus package.
Okay. All right, so someone wants to know, Erin, if the final takeaway for interns is that they cannot or should not see new clients via telehealth.
That is not the takeaway. If you are a registered intern and you have a qualified supervisor and you have a telehealth protocol in place and you are not working in private practice, then by all means, as long as your agency or whoever is okay with it, see new clients through telehealth. But if you work in a private practice setting, understand that technically the law says you have to have a licensed mental health professional on the premises. And remember that the FOMCA board, or not the FOMCA board, the 491 board did amend their rule to say, essentially, you can meet with new clients as an intern through telehealth.
Okay. And let me just see if we can squeeze one last question in here. So
Sure.
I've seen a lot of comments come up about the PowerPoint. So the PowerPoint is available for you guys to download under the handouts section in your GoToWebinar menu. If you're unable to obtain it from there, don't worry, because I will be emailing it out on Monday along with your certificate. So you will get a copy of this PowerPoint. You will also get a link to rewatch the presentation.
Could you also send them the Code of Ethics and the Professional Standards handouts as well, do you think?
Yes, Erin, I will send all 3 resources.
Also, if you guys have questions that we don't get to today, here's my email address. So just send me an email and I will try to answer it quickly.
Yes, I will do that. Okay, let me see. I'm just sorry, I'm trying to sort through all the comments that people wrote for the questions that you asked. So
Sure.
I see that this keeps coming up, Erin. We could make this the last question. Can you please repeat where we can find your telehealth consent form?
Yes. When you get that, when you open that PDF of these slides, you will see it here on this slide that has Jim Carrey typing away at a keyboard. Telehealth consent form. This is an extra instructions handout that I made at the beginning of the pandemic. And here's my screen by screen shots of how clients can get into my Zoom room, which would not be good for you to give your clients because they'll go to my Zoom room. But it's an example of something that you can do.
Thank you so much, Erin. We really appreciate all of your hard work. All righty.
Thank you. I appreciate you guys.
Thank you. So with that being said, we'll go ahead and close today's webinar. So just a friendly reminder to complete the webinar evaluation form, which will appear on your screen after I am done talking. However, keep in mind that if you miss it, don't worry, you will have a second opportunity, as the link to the survey will arrive in a follow-up email that we will be sending to you in about 1 hour, so at around 5 p.m. Please complete the evaluation form within the next few hours so that we can input your CE information into CE Broker. Now keep in mind that we do like to give everyone a few days to get their evaluation in, so I will be reporting and sending out your certificate along with all the resources Erin provided on Monday, this upcoming Monday, June 8th. Okay, so expect an email then. I'll also include the link for you guys to have access to the recording. So if you have any questions, please direct them to office@flmhca.org. And thank you everyone for participating today, and we wish you a happy and fulfilling weekend. See you all next time. Bye-bye.